Mr. Kennedy, welcome to you and your family, and congratulations. I appreciate Senator Grassley raising the issue of the Office of Refugee Resettlement within the auspices of Health and Human Services. I think this may surprise people, but that's actually the responsibility of HHS, the Office of Resettlement Relocation. Under the previous administration, as Senator Grassley alluded, there were roughly 500,000 children, unaccompanied minors, that were placed with sponsors in the interior of the United States. The previous administration took the position that it was not the federal government's responsibility once these children were placed with these sponsors. But the New York Times, in a series of investigative stories, pointed out that tens of thousands of these children, when they tried to follow up and find out how they were doing, whether they were going to school, whether they were being trafficked or abused, there was no answer, and they took the position it was not their responsibility. So I look forward to working with you to find those children and to make sure that they're not being abused. Millions of Americans are experiencing mild to moderate mental health and substance abuse issues, yet many struggle with timely and effective access. Primary care physicians are most likely to be seeing these individuals as opposed to a specialist, and it makes it important that these individuals, primary care physicians, be trained in patient-centered care, which would strengthen the integration of behavioral health care with primary care services. Is this something that you are concerned about, something you'd be willing to work with us on in order to implement?
Yes, Senator, and let me just reassure you that President Trump has personally spoken to me about locating those 300,000 children who disappeared over the last 4 years.
I don't think anybody has a fully accurate number, but it's hundreds of thousands, I agree.
And many of them we know have been sex trafficked and childhood slavery, and it is a blight on America's moral authority, and we need to find those kids. In terms of addiction services and substance abuse services, this is a priority for me. It was a priority for me when I was running for president during my campaign. I was a heroin addict for 14 years. I've been 42 years in recovery. I go to 12-step meetings every day, so I hear the stories every day. And I hear the many stories about denial of, or the barriers to access to care. And we need to improve that. And to answer specifically to your question, I think we can do that through GME, which is a program that is funded by HHS, that is the largest funder for medical school students. And that's one of the things for primary care physicians should understand addiction care. Addicts almost always go through a cycle where there is a moment where they hit periodic bottoms where they're ready to go into treatment. But it's fleeting and it's momentary. And we have that opportunity to save their lives. And then if we miss that little short window, they're off to the races again. I appreciate your answer. Our time is short. Let me get to one more question that I think is very important. Under the first Trump administration, the number of people receiving HIV treatment in Africa through the President's Emergency Plan for AIDS Relief, otherwise known as PEPFAR, it increased, this is during the first Trump administration, from 13 million people to 18 million people across 50 countries, primarily in Africa. Africa has about 1.3 billion people today, or in 2021. It's projected to have 2.5 billion people by 2050, or 25% of the global population. In 2020, PEPFAR reported that 2.8 million babies were born without HIV. That was something that would not have happened but for the PEPFAR program. So it has simply been one of the most successful public health programs in the world and saved approximately 26 million lives. Failure to continue this program, in my view, would risk ceding that leadership to adversaries like China
And I'd like to know whether you support the objectives and goals of PEPFAR, and would you work with me and my colleagues to make sure that this program continues to provide life-saving antiviral drugs to people who are most in need?